Welcome. Good evening, ladies and gentlemen, and welcome to part 4 of Decisions of Fate. Unfortunately, this is going to be the last class for this course. There's a lot to talk about in Jewish medical ethics, and I encourage everyone, even after the class finishes, to go online and to get some books about it. It's a fascinating topic, and keep learning, because as you know, learning never ends, right? Learning never ends. So tonight we are going to be talking about the dignity of the body, and what right do we have to make decisions about ourselves even after death? Now we talked about in a previous class, we talked about how in the United States, who makes the decisions about your care and welfare? You do, right? You are the final arbiter on everything that's done. So if you want to take the medication, you take it. You don't want to take the medication, don't take it. No one's going to force you. So tonight we're going to see how far that extends. Does it extend after you're gone? Do you still have any rights about yourself, or they just do whatever they want with you? Okay? So we always start with a case study. And the case study tonight is something like this. I don't know for how long it's been, but I'm sure it's been for centuries that medical schools use cadavers for education. They sect them, go through them, and study about them. So in this one particular medical school in Texas, they had a contract with the county. The county for years had a policy that if there were people that were indigent, or they had no family, or their family was poor, or whatever, they would give them a burial and whatever it is, but it cost a lot of money. So the medical school said, well, we can help you alleviate that problem by shipping the bodies to us. And that's what they did. So, most of the cadavers that came into this medical school were people that had previously already arranged to be sent there. Meaning, before they passed, they signed a contract that they wanted their bodies to go to medical science. But not everybody. 25%, 1 out of every 4 bodies that came into that medical center was either from someone that had no relatives, or the relatives were too poor, or there was no instructions were given. So the county felt it's a win-win. You ship off the bodies, their expenses went from $500,000 a year, where they used to pay for these funerals, even if they were a modest funeral, way down. The medical school was very happy. They had, and especially, you have all different types of people. So, their gene pool was varied. So they were okay. And so it was a win-win till someone shows up. Okay? And someone shows up, and the name was Ellie Shoup. And I'm not even sure if this is a male or Eli. It could be Eli, it could be Ellie, but they came. I'm going to assume that it's a woman. I'm going to go Ellie Shoup. So she comes, and she has a philosophical problem with this. Why? Just because the families are poor, just because they haven't given instructions, just because there's no next of kin is there, that's why their bodies get shipped off to the medical school. Perhaps it would be right, to offer a burial for them. Anyway, she got a letter published in the newspaper, and a whole tumult ensued, back and forth, and now a whole debate started. Now, the case study doesn't end. It doesn't end. All it asks us to do now is to look at this perspective and say, what rights do we have for our bodies after we're dead? Well, that's basically the question. Now, other medical schools changed their policies and said, we're not going to take any people, people that have no money, and because they did a study, the overwhelming majority of Americans today, about 75% of Americans today, prefer cremation. Now, for a number of reasons. Number one, financial. As I mentioned, I just did 2 funerals in the last 2 days. They're very, very expensive, extremely expensive funerals. So Americans, have chosen cremation. So, why don't we cremate them instead of sending their bodies to, So that became a whole study of, what to do with them. And then we're still trying to figure it out. A lot of medical schools have stopped. I'm saying a lot. Some medical schools have stopped using cadavers. And today you can go online and and do the same. So that's the debate. But the question that we need to answer is, according to Judaism, what is Judaism's opinion about the decisions we can make about ourselves after we die? What happens to us? Okay. And that's where this class is heading to. Okay. So the first thing is we have to define what we're talking about here. Okay. So what the question that is facing us, is a Jew allowed basically to go through with an autopsy? That's basically what it is. Because you're dissecting the body. Whether you're dissecting it for medical purposes or dissecting for other purposes, doesn't matter. This is what was called dissection, right? And the question that Judaism had is, are you allowed to do that? So let's go, like we always do. We go to text number 1. Go ahead.
Would that be the same as donating your...
No, that's not the same. That's a different thing. That's a different thing, which we will get to later on in the class. Here we're talking about someone that has passed on, and for whatever reason, maybe there's a necessity to do an autopsy on them. The doctors want to do an autopsy on them. Whatever it is, can we do that autopsy? Okay. What is the status of a body in Jewish law? I mean, maybe the status of a body is no status. I mean, do whatever you want with it and go for it. That's the question. So we have to come with a blank slate. Because I know you already know most of this stuff that we're going to be talking about. But just have an open mind.
And there's also the issue of a legal need to do an autopsy.
Yes, that will come into play. But that means that's what Dr. Lovich is mentioning. I just want to, for the people outside, what Dr. Lovich is mentioning is sometimes there's a legal issue here. That may take it out of our hands altogether. Altogether. Exactly. But we'll get. That's a specific case that we'll get to. We're talking about now someone has passed away, and for some reason, not odd, but for some reason, an autopsy wants to be done on this cadaver. Okay. So let's go to. I mean, JLI is. I'm going to let you in on a secret. I have the teacher's guide, which has more. So one of the things that they put in here are jokes. Now we're talking about cadavers and death and dissection and this, but they had a couple of jokes that I thought were funny. Most of their jokes are, but some of them, like for example, here's one where the attorney, doctor, how many autopsies have you performed on dead people? Yeah. Witness. All of them. The live ones put up too much of a fight. Okay? The other one, attorney. Do you recall the time that you examined the body? Witness. The autopsy started around 8:30. And Mr. Denton was dead at that time? The witness. If not, he was by the time I finished. Okay. So now that we got that out of the way, okay, let's get into the subject at hand. So what does the Torah say about our bodies after that we have passed away? So let's go to text number 1. I'm going to read it out for everybody. The Talmud says, one who transports human bones on a donkey may not place them in a leather saddleback and ride on top of them. For doing so, one treats them disrespectfully. Okay? So clearly, the Talmud is setting down a precedent to let us know that you know what? You have to deal with the remains, whatever it is, whether it's a full body, bones, whatever it is, in a respectful manner. Meaning that there is dignity to the body even after death. Okay. Now, when we say the word disrespectfully, what does that mean, disrespectfully? Now, we know that you're not supposed to kick it around, tie it to your car and schlep it around. We know that. Okay, but how are we going to define disrespectfully? What's the parameters that we're looking for? So in Hebrew, we're calling this term nibul hames. Nibul hames is treating the dead person with disrespect. Okay, what does that mean? So we're going to come up with a couple of case studies ourselves to see what the parameters are of how we have to treat the body after it passes away. Okay. So we come with two ideas. Number one is a person has an interest in how his remains are handled. Just as one should not abuse someone who is alive, one should not do so after they're passed away. Right? That's what the Talmud would tell us. And according to religious teachings, a corpse is a sacred entity. Okay? So that's different than principle number one. Principle number two is a corpse by itself is a sacred effort, and therefore it should not be mistreated. It can't be mistreated. So now we've set down these two principles. We know that after someone passes away, we have to do something respectful with the cadaver. We have to do something respectful with the cadaver. Okay. So now we're going to ask a question. The question is going to be like this. You don't mind turning to page 124. Now that we have a cadaver and someone who has passed away, and we know from the Torah's point of view that in order to save a life, what can you do? Anything, right? If you remember that there's only 3 mitzvahs in the Torah that the Torah says to us, Yahareg va'al yaver. You have to allow yourself to be killed rather than transgress, right? That's the general principle in the Torah. So, in order for us to, we're starving, and the only thing to eat there is something non-kosher. May we? Yes. You have to, if God forbid your life is in danger, we had this case before about desecrating the Sabbath. May we to save a life? The answer is yes. Yes, only the big 3. So now we have a mitzvah that we've just established now, that we need to treat the body with respect, which is a mitzvah. We don't know what we have to do with the body yet, but we know that we have to treat it with respect. Can we now supersede that mitzvah in order to save someone else's life? Yeah? And this is an ethical question. Can you do something to the body? What is that called today? An autopsy. Can you perform an autopsy for the sake of saving someone else's life? That was it. So let's go to the case study of this Rabbi Ettlinger that lived in the 18th and 19th century. I was consulted regarding the case of a patient who was ill with a unique disease. The doctors treated him, but to no avail. He died of his illness. Another patient suffered from the same illness, and the doctors sought to dissect the body of the deceased person to understand the disease and possibly find a cure for the patient who was alive. So they said to him, we would like to take the body, dissect it, research it, and maybe possibly we can save another patient. Under such circumstances, is it permissible to desecrate the dead? Okay, because what you're doing is you're superseding one mitzvah in order to save someone else's life. So in the beginning, Rabbi Ettlinger thought about it, and he used our reasoning, our rationale that, you have to push everything away in order to save a life except for 3 commandments, right? The murder, adultery, and idolatry. Nibul hames, desecrating a body, does not fall into the category. So his initial reaction was in order to sign off and say, yes, do it. Do the autopsy on him. Then he said, hold it. One second. Another principle. You see, this is the way Torah study is done. You measure one value against another value, one principle versus another principle. When is this said? He thought to himself, when is this said that you may save another person's life? Do it if it doesn't cause harm to Mr. B. You could save Mr. A, but if by saving Mr. A you're causing Mr. B harm, you can't do that, even if it's not one of the 3 main mitzvahs. So then he started to rationalize which way should he go, and we'll see what he says. So let's go to 100, and he says, text number 3, he says, nothing stands in the way of saving a life, right? That's our principle number 1. Nevertheless, if a person in mortal danger must steal from their fellows in order to save their lives, meaning I'm starving, I am absolutely starving, and I have no money and no one is helping me, okay? I have to steal in order to stay alive. It is forbidden, listen to this, it is forbidden for them to do so without intention to repay, okay? Meaning that if I'm going to say, we have the famous, Les Miserables, you're going down to the bakery and you're starving and there's a bakery there. Are you allowed to steal the bread in order for you to save your life? So what he's saying over here, only if you have intention to repay. If you have no intention to repay, you're not allowed to steal. Not allowed to steal. Why? Because your life is not better than someone else's. Meaning, you can't hurt someone in order for you to say, let's say, you're standing on the subway station and you're about to fall, so you pull someone else over you to save your life. You're allowed to do that? No. Of course not. Right? You can't cause someone else harm to save your own life. So even in a lesser degree, you can't steal from someone unless you are willing to repay him. At least you have the intention. But if you have no intention to pay him back, you're just stealing and running away, it is forbidden even to save your own life. Oh, okay. So now we have this issue now. How does this fall into the category of coming to this autopsy? So on one hand, we have one cannot save his own life through hurting someone else. So if you steal without intending to repay, you're hurting an innocent person. But if he intends to repay, he's not causing any harm, right? Okay, so how do you do it? How do you do it over here? So in the beginning, you say to yourself, well, you know what? It's not one of the 3 cardinal sins, right? Not 3 of the cardinal sins. I want to do it, but, whoa, 1 second. You're now going to transgress and you're going to desecrate the dignity of the body. Can you pay it back? You're hurting the body. Can you pay it back? No, you can't pay it back. You can't pay it back. So at the end of the day, after going back and forth in his mind and, researching sources here and there back and forth, he came to the conclusion that, no, you can't do the autopsy. Why can't you do the autopsy? Because he uses the theory of theft. And theft, you can't pay back the body. Well, what are you going to do? What are you going to sew it back? I mean, you're cutting up the body, you're taking the organs, you do this. You can't put them back whole again. And since you can't put them back whole again, autopsy is forbidden. So even though, and we said it before, that the doctors had written to him that it may save someone else's life, to him, it didn't matter. That does not override it. The overriding principle here is only if the person can pay back, which means by extension, just to give the point over here, just by extension, can you allow someone to steal from you? Can you say to someone, come into my house and rob me? Why not? Why not? Why can't you say, it's a gift? If you say to someone, go into my house and steal from me, a person has a right to say that to someone. Now, whether the person wants to do that or doesn't want to do that, that's his business. But if I say to you, you know what, why don't you go into my house and steal from me? I have a right to say that to you, right? Okay, right? Meaning I give you permission to go into my house and take whatever you want from the house. I don't care. That was the only way that Rabbi Ettlinger said that he would give permission for for an autopsy to be done, is if prior to death, the deceased would have said to someone, you know what, after I die, I don't care, cut me up. Once he says cut me up, then he gave permission to cut him up. Once he says he gives permission to cut him up, there's no question of repaying, because you're not hurting him. He had given you permission. So he used the theory of theft to justify his opposition to autopsy number 1, that he would not allow any autopsy and under any circumstances, even if it was to help, cure a disease. The only way he would allow it is with prior permission. That means if the deceased said, you know what, after I go, I don't care, do it. Do whatever you want. Okay? Now, many rabbis, I should say not many, the minority of rabbis today follow this principle. Follow the principle of the theft theory. Means they will not allow an autopsy under any circumstances except if the deceased allows it, has given permission, and we have nothing to worry about. But I have to be honest with you, the majority of rabbis do not accept this position. Think about it, it's a radical position. You're talking about under no circumstances can you do it, because you can't save another person's life by hurting the deceased. But if the deceased gave remission, so fine. Okay. And since it's an unpayable debt, as we learned over here, it's an unpayable debt, so therefore, you can't do it. So that's position number one. So I want you to keep in mind that when it comes to autopsies, and whether autopsies are allowed or not, regardless of the circumstance, doesn't matter. That you could help someone. According to Rabbi Ettlinger, his position is no, because it's unpayable debt, and that overrides everything else. Okay? So now, it's a little different than most mitzvahs, because most mitzvahs you can push aside, and there's no harm, no foul. If you have to wear shatnez, for example, to save your life, you're freezing outside, what do you call that? You're suffering from hyper frostbite, and the only thing that you can wear is a fur coat that is made up of shatnez. You wear that shatnez, right? If the only thing you can eat is something not kosher, you eat it, and something, all that, except something that you can't pay back. An unpayable debt, then it's prohibited to do that. Okay. But
if it's in the healthcare directive, it's okay.
But if the guy says, I don't mind, cut me to pieces, that's okay with me, then he would allow you to cut him to pieces.
Does that have to be written?
Probably, it probably had to be written, or it could be, an oral statement. I mean, I don't necessarily think it has to be put into a document. If the deceased said prior, sitting around the bed, and there were people there, and there were witnesses, and he said, I'm telling you right now, after I die, if you need to do an autopsy on me, I don't care what the circumstances are, do it. Then he just gave you permission to do it. Now, maybe there's no need to do it, right? Maybe no one cares to do it. Good. But if the case arises where the doctors ask for an autopsy to be done, permission was given. So this is what we're going to call the theft theory. The theft theory, because he bases his entire idea on this concept of repayment. And since you can't repay, that's not. But that's not the only. He's not the only game in town. Okay, he's not the only game in town. The other one that we have to think about is the sanctity theory. That's going to be different. The sanctity theory talks about the sanctity of the body. Okay, nibul hames, meaning that there is a prohibition of dissecting the body, not because of theft, not because of repayment. That has nothing to do with it. It's simply there is a mitzvah that we have to honor the sanctity of the body. It's not ours. Who gave you permission to fool around with it? This is a gift from the Almighty. He gave it to you. I want it back. In the same sort of. I mean, we came out kind of small. We're much bigger when we give it back. But I gave it to you. I want it back. It's not yours. It's on loan. That's it. Now, some of us use it wisely. Some of us abuse it wisely. Whatever the circumstances are, doesn't matter. It's not yours. It's on loan, and therefore it's called the sanctity theory. And then, so this theory was done, but was expressed by one of the greatest authorities of Allah in the Middle Ages. His name was Rabbi Cheskel Landau. He was a rabbi in the 18th century in Poland. He was chief rabbi of Prague. He was just a brilliant man. And the Noide B'Yehuda, anybody that studies, in rabbinical school knows about the Noide B'Yehuda. I mean, he wrote the responses on all parts of the Shulchan Aruch. He covered everything. He was just a brilliant genius. And here he had the same issue come up to him. He had the same issue. What was his? And this was the case study. You don't have it, so I'm going to read it out. Okay, you don't have this case, so I'm going to read this out. An individual fell ill with a urinary bladder stone. Okay? Now don't forget, this is going to be in the middle of the 18th century. Okay? The physicians performed a lithotomy.
Yeah.
A lithotomy. Now, what is a lithotomy? For those that don't know, a surgery to remove the stone from the bladder, as it was the customary practice for this particular ailment. But it was not successful, and the patient died. Yeah. He died. The rabbis of the cities were asked if it was permitted to dissect the deceased in the relevant area in order to learn how to better deal with a similar case, should one arise in the future. Is such dissection forbidden because of the desecration of the deceased, or permitted due to the potential life-saving value of the information that will help physicians be more careful in their work in the future? Okay? Now, If you remember, Rabbi Ettlinger would say to this what?
No.
No question. No. What did Rabbi Landau say? He took it from a completely different aspect. What did he say? So if don't, please turn to text 5, if you don't mind, on page 128. And he wrote like this. It is a clearly established law. Do you have the text? Right?
Yeah.
It is a clearly established law that we must override the Sabbath law in our attempts to save a life, even if the chances of success is doubtful. Remember, we talked about this a number of times. A building collapses, you go in there, even if the chances are so slim, 1%, 2%, that you'll find someone, and even if the person is only going to live, for a short time, we desecrate the Sabbath. Okay? That is a general principle in the Torah. No problem. However, everything is, whenever there's the word however, you're going to be thrown a curveball here. However, this is true only if there's a present threat to the life before us. Okay? Meaning that if a building fell and we don't know if anybody's in there, can we desecrate the Sabbath if there's no one there? No. You have to have a threat, right, to be there. As in case of an ill person or a collapsed building. Meaning I know that there's someone in there, we need to do it. But in the case there's no current patient who would immediately benefit from this dissection, rather, the physicians want to learn about the surgery because they might in the future encounter a patient who will require it. Certainly, we cannot override a prohibition for this lesser concern. Okay? So in the case, so before we go on to the next paragraph, so in this case here, let's make it clear, the doctors had asked them, the rabbis, that they would like to do an autopsy. For what purpose? Was there a patient that was suffering from this gallbladder problem? No. They didn't have anybody laying on the table, right? Or a stone in the gall. Bladder stone. Okay? They didn't have anybody that was laying there but what they wanted to do was for future information they wanted to. So what did Rabbi Landau say? Under these circumstances? No. 4, and then he backed it up with rationale. For if we were to indeed consider that a case of life and death, it would follow that this is a case of life and death, even though that there is no one here that has a life and death. But we think, look, I want to know how to do this in the future. I'm a surgeon that could help me. And this, we would consider this life and death, which would override the prohibition of desecration of the body. It would follow that all forbidden labors on Sabbath would be permitted if they had any medical benefit. Then anything you could say, anything. There's a prohibition of grinding medicine on Shabbos. Well, why wouldn't you want to grind medicine on Shabbos? Maybe someone is going to come into your house, with a headache. Maybe someone's going to come into your house, whatever the circumstances is. So even if no one were currently ill, it would be permitted to grind and cook medicines and prepare a knife for bloodletting because of the mere possibility that during Shabbos or immediately afterwards, someone will fall deathly ill and require these things. So therefore, every prohibition that had some connection to medicine would be permitted to be done. No, and you could take it even further. You could take this principle and even go further. But let's finish what he says. If we were permissive about dissection, they will dissect all our dead simply to study anatomy and know how to treat the living, right? Because every person, you learn something from it. No matter what the person died from, you learn something from them. So he said. So his argument was, no, sorry, you can't. You know what? Because there is nobody here that we are directly benefiting from this dissection, no one is, therefore I have to say that it's prohibitive, because he says it's a slippery pole, right? It's a slippery pole, meaning that if I allow you to do this, everything is going to be open. What about going to the, you would talk about, we should go to the beach on Yom Kippur if people are swimming because maybe someone is going to drown. So you have to desecrate Yom Kippur to go to the beach and sit on the beach all day on Yom Kippur because there are people swimming in case someone drowns. Does that make any sense? No, that you wouldn't allow that. You would tell people get out of the water on Yom Kippur, right? Go to shul instead. So here, okay, him and Rabbi Ettlinger come to the same conclusion. Both say what to autopsies? Generally, no. Rabbi Ettlinger will say no because of the theft theory, meaning only time he will allow it would be if he agrees, if the deceased agreed to be cut up. And Rabbi Landau would say no, except in one particular case, if there's clear and present danger. Meaning if there's a case that you know that is suffering from the same ailment and that this autopsy can help that particular patient, and there's what he would call pikuach nefesh lifanenu. Pikuach nefesh lifanenu. Pikuach nefesh means a danger to someone's life. Lifanenu, present. It has to be present that we know of the case, not that it theoretically that it could happen. A lot of things could happen, but if there is a clear and present danger in front of us, he would give permission. He would give permission to do this. So we have two rabbis that look both at the concept of autopsies, and they went two different directions. So in both cases of nibul hames, which again, just to repeat what nibul hames means, it means it's desecrating the deceased. The general rule of thumb is no. Neither Rabbi Landau or Rabbi Ettlinger would allow it except under certain specific cases. We are still left to think about what that presence means. When we say clear and present danger, what does it mean present? I mean, did you have to have the patient in the same hospital? What if the patient is 4 miles away? What if the patient is in a different city? What if we know? So that we're going to have to set parameters to. But right now, we have these two theories when it comes to. Now, why is this so? Why is this so? That we are so strict against autopsies, this? Because the body is sacred. That's called the sanctity and the divinity of the body. And if you take a look at text number 7, please. Text number 7 on page 131. Okay, we will read this. This is written by Rabbi David J. David Bleich, again, who's around today. The rationale underlying the regulation mandating respect for the dead is a Talmudic parable. Why are we so careful about not doing anything to the cadaver? Being very, very careful. Why? Because there's a story concerning a pair of twins. One of the twins grows to adulthood and is crowned king of the realm. All right? He's what we call a boy that did good. Okay? He made good, right? He went, he studied, he joined the army, he fought, he was victorious, and eventually what they did to him was they crowned him king. Can't get better than that, right? And I'm not talking about Elvis in Memphis. I'm talking about king of the land, okay? The second became a highwayman. Now today, I don't know who uses the word highwayman. In high school, we used to talk about the highwayman, the poem, and the highwayman. Today, we would call him a bandit, right? A robber. And so two brothers, twins, one becomes king, one becomes a bandit. The bandit is apprehended and executed as punishment for his crimes. Okay? So one did good, one not so good, right? And he's dead, executed. Suppose then we are told the body of the executed twin was placed on public display. Would not passerby scrutinize the body and, perceiving what they believe to be the familiar countenance of the ruler, assume that this is none other than the king himself who has been punished so ignominiously? Right? They would think, oh, look at that. The king is hanging from a tree. I mean, yeah. So you wouldn't want to do that. Therefore, he writes, man is created in the image of God, right? With the result that, however that anthropomorphic term is to be understood, whatever we think about, what do you mean image of God? How can you create someone in the image of God? God is not physical. God is not material. How can you? So he says, regardless of that, this is not a Kabbalistic class. So he said, no matter how anthropomorphic that the term is to be understood, the human body reflects an aura of divinity. That's the key here. The aura of divinity. Just as the king is dishonored in the indignity meted out on his twin, God is dishonored in the dishonor of the divine image associated with the human body. Okay? So the Talmud says, if a king says, you know what, I want to forego any honor to me. I don't want any on you. Because if a king walked into this room, the first thing we'd all have to do is stand up. We have to show him honor, have to give him the hand. A king says, nah, I disregard the honor. No. Ein kvoidei machal. His honor cannot be disregarded. A rabbi, yes. If a rabbi, a nasi, walks in and says, you know what, I don't want any honor, don't stand, yes. Kvoidei machal. He can forgo his honor, but not a king. A king is way above that. It's not your choice. You have been put in this position. You may be small in your eyes, but you know what? You're big in the eyes of everybody else. So don't think of yourself as a shrimp, okay? So the same thing is true here with the body. The body is something that reflects the divinity of Hashem, and therefore it has to be done with intent, with complete respect, without desecration. And the only exceptions would be to this rule would be, according to Rabbi Ettlinger, nibble with consent, right? Nibble means the section with the scent, and according to Rabbi Landau, there would only be if there was a clear and present danger. But other than that, everything is forbidden. You have to treat the body with respect, and that's not only the body itself, but even parts of the body. Okay, parts of the body. So if God forbid someone suffers an amputation, you have to bury that limb with them. That's God forbid, if you see, there's a heartbreaking scene, but every time that there's a terrorist attack in Israel, God forbid, there's an organization, Zaka, that comes and, clean up afterwards. You see them collecting the blood, because all of that has to go into the coffin. I mean, all of this has to be buried. And you can imagine, after a horrible scene, what it's like, all because of this principle. The principle is the aura of divinity of the body. That everything that Hashem has given to us is completely sacred. So it doesn't matter whether it's, when we first started in text number 1, remember the first Talmudic lesson we learned was bones. Even the bones, after everything has already been gone, right? Gone. Even the bones of the human being has to be treated with respect. So that's kind of the general rule of thumb in Judaism, traditional Judaism, is that an autopsy, unless, and we're going to get to cases where, of course, we're going to allow autopsies, because even Rabbi Landau, even Rabbi Ettlinger allows it under certain circumstances. But a general rule of thumb, if the doctor says, I want to cut the cadaver up, the answer is no. No, you can't. I'm sorry. Okay, please, of course.
Because I come from a medical background, just like the doctor. Do the students at Albert Einstein learn this? Is this part of
That's a very excellent question that you ask. That is an excellent question that you ask. Because they ask this question, and there is an appendix in the back here. So according to what we have learned, is one allowed to, you just asked this question, is one allowed to go to medical school where dissection is part of the instruction? They asked this very question. I'm not sure if you have the appendix. They go through it. They go through each issue. So, for example, the prohibition against kavura, one of the prohibitions that we're going to see later on, besides the dignity of the body, is you have to bury it in a timely manner. We'll get to that in a moment. That you're not responsible for. You asked for the cadaver to come in here as a medical student. So that is no obligation on you. The cadaver is here beyond. Again, this is an issue of delaying. It's not your business. Not your business. The only problem would be nivul. If your instructor handed you the knife and said, start cutting. That, they say here, is, according to the Noida Yehuda, that we just read, according to Rabbi Landau, what would you have to say? I can't, because when the student makes an incision, they are desecrating the corpse. However, nothing is ever black and white. No. According to the Binyan Sian, which is a current decisive halacha, there's a heter here if the deceased willingly donated a body to science. Because then we go according to Rabbi Ledinger's heter. So if most cadavers today in medical school were there, remember what we talked about in the first case study, no one is throwing your body unwillingly there. So if the person allowed it to do it, you do it. But if the body was unclaimed, there may be a problem. But I think some students are careful just to watch the proceedings. My answer to you would be that if you're an Orthodox kid going to medical school, you should ask your rabbi, and then he'll give you an answer. Go ahead,
Also,
doctor.
analogous to that question is, what about a Kohen?
A Kohen,
See?
which is ratchets it up. Because a Kohen's not allowed to come into contact with any this body. But of course, you look, there is heterim. But if you eliminated all Dr. Cohens from the phone book, could you imagine if you eliminated all the Dr. Cohens from the phone book? You'd have no doctors. 4 doctors in America. So you know, and then there's the issue, of course, is who is the body, what is the body. But I'm certain to say that since we have many from kids, Orthodox kids in medical school, in Einstein and other medical schools, and they found ways, to get around it, and it's not an issue. What we have to discuss now is the parameters of the clear and present danger. What does that mean? How would he interpret that? Does it have to be okay? So we have to define Rabbi Landau. So here is I'm going to give you a couple of cases where rabbis ruled, even if the body is not, even if you don't have a case where it's literally someone dying, but it could help, it's allowed. If a person with cancer dies after receiving you don't have this. This is in the cheat sheet. If a person with cancer dies after receiving an experimental drug, okay, it would be permitted to perform an autopsy to ascertain possible toxicity, foreboding potential harm to other patients on the same course of treatment. Because there are other people that are taking, if you're the only guy, probably not. But if there are other people taking this drug and you die because of this drug, they would allow you to take an autopsy in order to help people, even though there isn't anybody, may not even be in the city. It may be in other cities, but because it would help people who are on the same protocol as you are, then you can do that. Okay, so it's pretty wide, the clear and present danger. Even more so, he says at a convention in Philadelphia, 1976. If you remember this, I guess this was called the Legionnaire disease. I think they suffered. It doesn't say, but I'm thinking if I remember, several hundred members of the American Legion were afflicted with a pneumonia-like illness, and many died. Jewish law would allow an autopsy on those who died to discover the offending organism and treatment to save the lives of other patients afflicted, many of whom were dying of the same illness. But even though you may have, at the same time, even though you may not have someone in your hospital or whatever the circumstances that is dying, but because other people were afflicted as well, they would allow you to go through an autopsy. So we see here that every case has to be judged according to where we find ourselves in the process. And generally, if it could help society, meaning you don't have to have someone that's just dying, but not in the future for experimental reasons, the rabbis here seem to be pretty reasonable. Okay? Of course, it'd be unreasonable to assert that the other patient must be literally rad. As what's the chances of having the same guy in the same hospital with you? It doesn't make any sense. So therefore, even Rabbi Landau would apply his permission. Now, here's a different case, and here's where we have to put on our thinking caps. Okay, say multiple patients suddenly start dying during appendectomies. Okay, people, you have a rash of people dying during appendectomies. This is a surgery performed on patients that usually have a quite low level of risk. I always say something like this. You know what minor surgery is? Surgery done on someone else. That is what minor surgery. I don't care if it's an ingrown toenail. It's major surgery when it comes to my toe. Okay? But here, people generally appendectomies, you come in, you come out, I've had it in my family, a couple of people have had it. Now, all of a sudden, people are dying from appendectomies. Okay. Suppose further the physicians think that through dissection, and only through dissection, meaning that they insist that we need to do an autopsy on this guy who just died, they will be able to get to the bottom of the cause of these deaths and thereby save the lives of those who will indubitably need appendectomies in the coming days, weeks, and months. let us also assume that there's no known patient anywhere with appendicitis. Meaning that if someone is in the hospital with an appendicitis and people are dying because of these appendectomies, obviously Rabbi Landa would say, absolutely, absolutely. But there's no one in the world that has appendicitis. Okay, no one. Except that we know that people are eventually going to come down with appendicitis and we're going to have to go through that surgery. Even if someone currently had this malady, the information gleaned from the dissection will take a few days to study, and thus it will not help anyone suffering right now from this appendicitis. But the physicians find something, it will help those who come down with the problem in the coming weeks and months. What would Rabbi Lando say to this? One might argue that Rabbi Lando would forbid the dissection in such a case because no one is benefiting from it right now, or because in the future someone may. So let's see what Rabbi Bleich has to say about this. This is excellent. This is what really comes down to the meat and bones of this class, is these real questions. Real life questions. So what does Rabbi Bleich say about this? Although the existence of a presently afflicted patient in an obvious instance in which suspension of halachic strictures is warranted is by no means the only example. Just because you don't have someone that's laying there, it's not the only time when you would allow this overriding of Jewish law. And he takes an example from left field. You would never think about this example. What does he say? Listen to this. This is why there are brilliant people in the world, and then there's people like me who benefit from brilliant people in the world. Okay? In many outlying settlements in Israel, there is but a single qualified healthcare provider in residence, usually a nurse. You know, you go to these settlements out there, you don't have doctors in every place. You usually have a nurse that covers a wide range. Not infrequently, an emergency occurs on Shabbos, and in order to monitor the patient's condition and administer intramedical care, the nurse, she's the only health provider, must accompany the patient in the vehicle, transporting the patient to the nearest hospital. So she goes with them. They drove to the hospital on Shabbos. Okay, the hospital is miles away. During her absence, there's no trained professional qualified to provide emergency care should any other inhabitant become afflicted by illness or suffer an accident. May the nurse ignore Shabbos prohibitions in order to turn to her post? She can't walk back. She has to drive back. Is she allowed to drive back? Yes. Even though, is there a clear and present danger? No. There's no clear and present. If there is, then obviously there's no question. So what does Rabbi Bleich write? The likelihood that a child in any specific family will become afflicted with a life-threatening illness on any given Shabbat is remote. I mean, you have to think, is there going to be a kid in one family that's going to get so sick? You know, hence, the mother's preparation for the eventuality cannot be categorized as an act of pikuach nefesh. You know, you can't do anything because there's no clear and present danger. However, when past experience point to a significant likelihood that one person in a large population of individuals will be stricken in such a manner, a number of rabbinical decisors have ruled that the statistical probability of the occurrence of such event is deficient to warrant the nurse's return to her post. So it's a good likelihood that if she's covering 1,000 people, you know, in the Yishuv or in the Kup, whatever it is, it's a good likelihood someone is going to get sick, and therefore she is allowed. In effect, present awareness of the statistical probabilities of impending danger renders the danger itself present in nature. Wow. Okay? That is a statistical probability of impending danger, meaning that there's a good chance of 1,000, 2,000 people that she has to, care for, that someone is going to get sick. That renders the danger itself present. So let's go back to the appendectomies. Now, are people going to get appendicitis? Yes. Generally, in a country of 250 million or 260 million people, I can't tell you the statistics, but generally on any given day in America, I would presume there are thousands of people with appendicitis in the United States of America that are going on. Are they any here in Long Beach, California? Maybe not. We have to survey the hospitals. But if we can find, just like this, the nurse, even though that there's statistics that show that there are people that could possibly benefit from her being there, she's allowed to override Shabbos. And in that case, I would then extrapolate that, yes, in this particular case, when there is this rash of deaths due to appendectomies, you're allowed to do this. So according to this view, because appendicitis is a very common problem, and an appendectomy is a common solution, we can do an autopsy even if there's no clear and present danger. Because statistics will tell us that yes, there's a good chance that someone will benefit from it. I thought that was a very insightful and creative way. Now see how these people's minds work. We are so focused on the appendectomy. You know what? How am I going to explain this? I'm going to have to do all the statistics on this, and I go to this statistics and back. No, you broaden your view. That's why people who have these broad shoulders, these great rabbis, they have this entire set of Talmud encyclopedia in front of them. So they're not focused only on the question at hand. Then they extrapolate what is a likable case, what is a different kind of a case. There's 13 hermeneutical ways how to expound on the Torah. This is creative thinking, and he comes up with a thought about a nurse in some far yishuv, in Israel. But it's brilliant, and that's why we have to tip our hats to these people, who have come up with this. So let's summary of what we've done so far. General autopsies is a big fat no. Okay, autopsies that will benefit people, yes, under certain circumstances. According to Rabbi Lettinger, it would be if the guy said yes, no problem. He allows you it gives you permission. According to Rabbi Landau, only if there's a clear and present danger. And you saw, according to Dr. Rabbi Bleich, that he kind of sets the parameters, well. I just want to read this question from Dr. Weiner. Why do you say the stone patient wasn't suffering? Well, why did the patient seek medical help? Could it have been pain? Remembering that it was quite subjective, so the autopsy could benefit. I'd have to think about when we went back to the case. I think the case he was suffering. The guy died with the stone, right? Mm-hmm. The stone patient actually died. He died, but he died, the stone patient, and there was no other cases. There was no clear and present danger when that came. Okay. So that's generally the rule of thumb. Now we're going to go into some specifics. Virtual autopsy. Virtual autopsies. This is already cadaveric biopsies. Okay. Oh, this is already fancy language that no Chabad rabbi knows what it means. Okay. Okay, forget about it. So we have over here, if you don't mind turning to text number 9. In my opinion. Now they asked him about what they call virtual and autopsy. I mean, this is to Rabbi Moshe Feinstein. We've already dealt with him beforehand. He was a leading halachic decisor of the past generation. In my opinion, it would not constitute a violation of desecration if physicians would not cut open the limbs, neck, or torso, but only seek to perform a needle biopsy in order to obtain fluid for diagnostic analysis and evaluation. Because they didn't cut him, they just took out some fluid. It is not a form of desecration, and it is permissible because it is very common to do such procedures on the living. So his criteria now becomes something else. If it's done on the living, then it could be done on the dead is worse than the living. If you can poke the living and do this. Likewise, removing blood via needle and syringe for analysis does not constitute desecration and is permitted, although I have not found this stated explicitly in earlier sources, meaning that he looked through all of the background, Rabbi Landau and this guy and that guy. He's never seen it permitted. It seems clear to me that this is true. And there's no problem if you want to extract fluid, if you want to do it without cutting any of the things. Okay? So therefore, for example, doctors and students often practice intubation on dead bodies. How else would you be able to do that? So Rabbi Elishav ruled that this practice, it does not constitute nibble because the procedure is done on living people. If you would cut open a guy's throat to insert. Now, that has opened up a can of worms. Why? In the olden days, when you had very little surgical procedures, because of one thing. Nowadays, you do all different types of surgery on everybody. You're cutting everything in the body. You're cutting open this, you're cutting open that. Would you say the same thing if Dr. Lowe's, a general surgeon, he cuts you open and he does whatever he does in there? That's done on a living person. Would we allow that to a cadaver? Probably not. So it's not so simple. When he says just because it's done on a living person, we can then extrapolate and say, well, anything that's done on a living person could be done on a... No. There are some qualifications to this. Number one is that you have to make sure that there's no cutting. Cutting seems to be, to them, a big problem. Cutting a limb, cutting the torso, just cutting the guy up is the issue. But if you just want to extract, then probably, you're doing okay. Virtual autopsies or virtopsy would be called virtopsy. Virtual autopsies or virtopsy is as an alternative to traditional invasive autopsies. What is a virtual autopsy? CT or MRI scans. So that's no problem. That's no problem whatsoever. We'll read text number 10 if you don't mind, please. Post-mortem MRI is a potential diagnostic alternative to conventional autopsy, but few large prospective studies have compared it to accuracy of conventional autopsies. I mean, we don't know yet. Virtual, I think Dr. Lowe's mentioned it before. We assess the accuracy of the whole body, post-mortem MRI, for detection of major pathological lesions associated with death in a prospective cohort of fetuses and children. Minimally invasive autopsy has accuracy similar to that of conventional autopsy for detection of cause of death or major pathological abnormalities after death in fetuses, newborns, and infants, but less accurate in older children. If undertaken jointly by pathologists and radiologists, minimally invasive autopsy could be an accessible alternative to conventional autopsy in selected cases. So rabbis, of course, if you came to them and said, look, we're not going to do a full autopsy, but we'd like to do a minimal autopsy, they'll give you that, what we call heter. They'll give you that leniency because it's doing much less because the desecration is much less. So, but, of course, you have to weigh the benefits of it. I mean, what she's saying is, we're not so sure yet. We're still in infancy, thing. So, again, if it's a non-invasive thing, then I think most would agree that it's okay. You don't have to worry about it. Certainly virtual is not a problem. You can do that. And then minimal invasiveness, then of course you would have to, each individual case would have to be, but again, it would have to be under a circumstance that would allow us, to do these things. Now, someone had brought up in the beginning of the class about, I think Dr. Lovich mentioned about a case legalities. Okay. Now there's some cases here, doesn't happen very often, but once in a while, it happens where the dead body is now entangled in a legal issue, a murder. Okay? A murder. Now, the dead body is now taken first by the coroner. They're not going to release the body. You could forget about that. Once there's a murder, they take it. It's their property. Now, much as you can scream and shout, now they're going to want to know, okay, what was the cause of death? That's the cause of death. You got to do an autopsy. The time of death, the cause of death is. Most of the times you will not win in court to stop this. And there's very few judges are going to override an autopsy when it comes to a murder case, especially if the body is of the dead, especially if the body is of the dead person. I'm as smart as the attorney back there, right? Especially if it's a case of you want to know about who killed the guy. So generally you can fight them in court. You can try to fight them in court, but if the DA comes in, and first of all, they have all the power and all of the time. So, you're running against you. The guy was killed on Monday. You want to bury him on Tuesday. You could forget about that. Okay, that's not going to happen. They're not going to sign off, and no mortuary is going to accept the body. So generally you can fight them in court, but the truth of the matter is, if you think about it, in order to solve this crime, you are possibly arresting a murderer. It may be that you want to know. Like if someone dies of poisoning, you want to know if the wife killed him. Probably, right? You'd like to know that, if the wife killed him or not. Or maybe I remember the case. There was a case in Texas a while ago. I had seen this. One of these shows, 2020 or things. There was a bully in this small town in Texas. I mean, the guy was just the most rottenest guy. and just causing problems all around, bad neighbor, bad guy. And one day somebody came and killed him. And everybody in town knew what happened. Now, the sheriff in town didn't arrest anybody, would not arrest anybody in town. So this became a federal case. I mean, murder is a federal case. So the feds come from where? Washington. So they're, East Coast elitist guys, coming to the small town of Texas who have their own way of living. I mean, they don't get the mentality of small. No one in town talked. We don't know. We never even heard of this guy. I didn't even know the guy lived in town. And for weeks they spent gathering evidence, and they could not come up with anybody that would talk in this town. They had to leave. Case closed. Goodbye forever. It's a cold case. That's it. Goodbye. No one got punished for that case. But in most of the cases, you would want, the society would want to come. So I guess if it's a legal case, I don't think you can have much luck, fighting it. Many states now, I would say, have what we call a stipulation that you cannot do. It's what's called a religious accommodation. You cannot think we'd like to do it. The family says no, you cannot do it. This is what is called a religious accommodation. In the absence of compelling public necessity. Now, we just went through now what we call a pandemic. In this pandemic, you may have had a big problem because if someone, God forbid, died of COVID and they wanted to do an autopsy, they would argue it's a compelling public necessity. People are dying all the time. We need to do. But in the absence of public necessity, so you'd have to go back and forth in court if you wanted to stop that. No dissection or autopsy shall be performed over the objection of a surviving relative or friend of the deceased that such procedure is contrary to the religious belief of the decedent. Or if there is an otherwise reason to believe that a dissection or autopsy is contrary to the decedent's religious belief. So compelling public necessity shall mean that 1, the autopsy is essential to the conduct of a criminal investigation of a homicide of which the decedent is the victim, meaning that we want to find out. Or 2, that discovery of the cause of death is necessary to meet an immediate and substantial threat to the public health, and that a dissection or autopsy is essential to ascertain the cause of death. So those are the only 2 ways they can override it. Generally, if you say no, the answer is no. Okay. So that what about solid tissue? What about solid tissue biopsies as are done for diagnosis? No, solid for living people. Obviously, you can cut the body up. I mean, if you have to take God forbid, you take a biopsy for cancer, of course, the answer is absolutely yes, because the reason for doing that is to save the guy's life. So there's no problem about that. No problem about that. So that's one issue. That's only one issue we're dealing with when it comes to death in the cadaver. Now we have a different issue. This issue that we talked about is called nibul hames, the desecration of the body. The second thing is that we have a mitzvah of burying. And not of just burying, but burying in a timely fashion. Meaning that the mitzvah is that if God forbid someone passes away, as quickly as you could get him into the ground, that's what you want. You want to bury him, think. So, if you don't mind turning to text number 11, if the deceased had instructed that they not be buried after their death, we do not obey. There's a guy wrote in his will, don't bury me. Okay? I want cremation. Okay? We don't. Now, that's only if you're living in Israel and you can override the deceased will. Because you are commanded to bury your dead, as the verse states, you shall bury them on the same day. Okay? You gotta bury them on the same day. Now, okay. So, there's interesting questions. What if the deceased said to the son, he doesn't want him to say Kaddish? Right? Then probably, as hard as it is, the son doesn't need to say Kaddish. The father says, I don't want you to go through the hassle. I know how hard it is 3 times a day, every year. No, I don't want you to say Kaddish for me. So probably he doesn't have to say Kaddish for him. But because Kaddish is, it's not burying. Burying is midaraisa. You have to bury them from the Torah. So the mitzvah even though that there's a mitzvah, l'kaim divrei hames, that when the deceased person wrote in a will that this is what he wants to be done, generally we follow. That means, if he wants to split up his estate this way, that way, or anyway, the mitzvah is to follow the words of the mitzvah l'kaim divrei hames, except when it overrides Torah. I mean, if a guy says, I want to be cremated, you don't cremate him. You don't cremate him. The unfortunate part is when we live in the United States of America. Living in the United States of America, dina de malchus dina, the law of the land is the law. So now you're faced with this problem where the deceased wants to be cremated. The children don't want him to be cremated. There you run into a huge issue, because many judges in America will be very, very reluctant to overturn the person's wishes. You have to show, no, the person was not well, he suffered from some disease, he wasn't of clear mind. Yeah, so then the judge would put a stop order. But overall, you're better off, if you can, to do it. And unfortunately, more and more we're facing this. More and more we're facing. I've never faced as many issues, of cremation as I had in the past couple of years after COVID. And for a number of reasons, and probably the biggest reason is financial, because it just costs too much to bury. It costs too much to bury. So, and even if there's not, I had a case just a few weeks ago of a friend of mine, and he told me beforehand, I'm sorry, Rabbi, I know what you're going to say to me. You're going to be very angry with me. I want to be cremated. And I tried every day. I called him every day. I said, I'll take care. And it wasn't financial. This had nothing to do with finances, because the guy had more money than anything. Yeah. He just did not want to go in the ground. That was it. I said, we'll find another place, a green. How about a green burial? Green burial, you don't have to go on the ground. They put you on the ground, they cover you with leaves, and you kind of just rot away into the ground and have a good day. No. I want to be cremated. Okay, I want to be cremated. I said, well, we'll put you, we'll have you in shul. We'll prop you up like Weekend at Bernie's. Remember that movie, Weekend at Bernie's? You ever saw that one, where they prop him up for a weekend? We'll prop you up in shul. I'll put a seat there with you. You'll be sitting there. So what? You know what? No. I tried every argument, everything, and then he said to me, Rabbi, I love you and I care for you. I said, please, I want to come see you. He was living out of town. He said, absolutely not. 2 days later, he died, and I just could not get him to change his mind. I just, couldn't. I said, and I warned him, you can't be set for you. We can't. No one's going to sit shiva for you. Good. I don't want anyone to sit shiva for me, anyways. I'm going to besmirch your name. No, I don't care. I'm dead. What do I care? So this is we're facing more and more and more. And what's worse is that there are Jewish mortuaries that are offering already cremations. They're offering. I'm not going to mention any by name, lest today it's a very litigious society here. But there are Jewish mortuaries that offer cremation. And you're fighting against. Minimum, I'd say minimum. If you're going to go bare bones, $10,000. I mean, that's minimum. That means you're not getting a nice casket. You're putting your beloved parent in a plain pine box with no accoutrements. No TV inside, no air conditioning, none of that. And you're going to, you're not getting buried next to, to Al Jolson, up on the hill over there. You're getting buried next to Schmerel, and there's $10,000 minimum, and if you're not prepared, it's going to be more. It could be $15,000 to $20,000, $25,000. A person thinks cremation is a fraction of that, of that. So it's a problem. But in tradition, the body has to be buried in the ground. For you were made from dust, and to dust you shall return. The human body was created from the earth, and our body is it. Upon death, the depart for burial. And if you go even further, even those opinions that tend to be more lenient regarding the question of desecrating the dead would agree that there is no permission to provide bodies to medical schools in Poland. I mean, because in Poland, when you would die in Poland, no, you can't. Why are you going to a medical school? We have done an investigation into the protocols of the prosectorium. That's the medical school and the dissecting room, and I've learned that many of the limbs of bodies donated to the medicals are never buried. I mean, they cut them up and they don't bury them. Some are scalded, some are stored in containers, and some are branded with numerals. The Jerusalem Talmud states, when the Torah commands bury them, it is instructing us to bury the entire corpse. This informs us that if part of the body is left unburied, it is as if no burial had occurred. So he's warning you that, you got to get buried and everything into the ground. So if we go back to our first question that we started about, who knows, years ago, it seems, that we're sitting over here, a long time ago, the medical school in Texas, can you donate your body for medical research? The answer would be no. No, because according to, there's no rabbi, because it's not, the body has not given permission, right? I mean, number two, there's no clear and present danger. And according to him, here you see, if the body has to be buried completely, they're going to cut you up, and there's a possibility it won't be buried completely. So if God forbid someone dies, and the school asks you, could you please donate the body of your loved one, your friend, or whatever, the answer is no. Judaism will prohibit that. You have to go into the ground. When will it allow? So we talked about the cases where it is permissible to do that. Okay? And the key is to try to the best of your ability, and I use this carefully, to the best of your ability to bury as soon as possible. Why? Because it says the dust, listen to this, the dust returns to the earth as it was at the start of creation, and the spirit returns to God who gave it. When does the spirit return to God who gave it? When the dust returns to the earth. Meaning that as long as the body is not in the ground, the soul is suffering. Means that it's not going up to heaven. And that's another reason, Kabbalistically, why the body needs to be dealt with sanctity, an aura of divinity, because part of the soul is still in the body. It's still still trapped in the body and will not be released until the body is put into the ground. So the rabbis have allowed, God forbid, if there's a family member that needs to be in town, so they'll let you delay it. Or if you want to go to Israel, that takes a little bit of time, the paperwork, and get you to Israel. So they will allow you some leeway in allowing you to do that. But this only means for a few days. Cutting yourself up in a medical school could take months. It take months for you to be buried. Who knows how long they can keep you there. So that's why it's thrown out. So let's summarize. The section, Nibul, only if it's given by permission according to Rabbi Ettlinger, Rabbi Randla, clear and present danger. Burial, everybody agrees. What part of the body has to be buried? All of it. When? As soon as possible. If the postmortem procedure delays burial, this is a problem. Unless the delay is relatively short-lived and deceased, ask for it, please. I'm asking you, please, I want you to wait until all my children are here. The children can be all over the world, may take them a little time to get together. There you have to wait. Otherwise, you go out and you do whatever you have to do to do this. Okay. How important is burial in Judaism? We asked the question. Do we really need to bury somebody? Well, what's the difference really? The guy's dead. I mean, is there going to be a difference if we cremate him? The Neptune Society, every few weeks I get a letter from the Neptune Society. You're going to go to see me. And you could be like, the Sharks dinner, whatever, to put you overboard. Well, what's the difference? Once you're dead, who cares? Right? Who cares? No. The mitzvah of burying the dead has such stringencies that we don't find by other mitzvahs. I'll give you an example to this. This is called a mess mitzvah. What is a mess mitzvah? Mess mitzvah is this. In the Torah, it says, before Dr. Lovitz brought up the question of a Kohen. A Kohen has certain specific restrictions where he can go and who he can become defiled by. And now we're not talking about today. Today it's much more lenient because everything is rabbinical today in nature. It's not biblical. The Kohen is not serving in the temple or anything. But go back in time. We're sitting now 2,000 years ago in the middle of the era of the Second Temple. The year is 100 CE. No, CE, it's gone already. BCE, before the Common Era. The temple is still in existence, okay? And all the rules and regulations from the Torah are pertinent. A Kohen is not allowed to defile himself except for his very personal relatives. His father, his mother, his brother, his sister, his son, his daughter, and his wife. Okay? And the sister only if she's not married. She's married, husband business. But okay, those are the ones that he is allowed to desecrate and become defiled for. Okay? Very strict rule. If he doesn't, I mean, if he goes to a funeral, he is then labeled Tameh. He's labeled, defiled, and he must go to the mikveh, because if he doesn't purify himself and works the service, punishment is misa b'dei shamayim. I mean, heaven will take care of him. This is how strict it is when it comes to a kohen. Now we're going to ratchet it up a little bit. Among the Kahanim, there was one guy that was called the Capo de Tutti Capo. He was the boss of all bosses. He was the Kohen Gadol. Okay, the Kohen Gadol is not allowed to be defiled by anybody. Anybody. No one. He is of a different category altogether. Father, mother, no one he's allowed to be defiled. Why? Because since he serves every single day in the temple, and his service is of the highest standard, so he has to be careful from where he walks, where he goes, who he comes into contact with, who he shakes his hand with. He is going to be super, I mean, you remember when COVID was around? Mm-hmm. How we were like 6 feet away from each other, 17 masks, and hoods and all of that stuff. He has to do that every day. You have to stay 6 feet away from him. You can't shake his hand. You can only give him like a fist bump like that, because he serves every day in the temple. And if God forbid he becomes defiled, it's a huge problem. Yet, the Torah says, even with all of the restrictions and understanding the importance of his position, that, he goes into the temple every day and he runs the service and he does that. If he is walking along the way and he finds a corpse laying on the side of the road, this is what's called a mes mitzvah. He looks around and there's nobody to help him. He himself has to go and bury that body. Think about that for a moment. We suspend everything else. All of the other restrictions that he has upon himself, not his father, not his mother, not his brother, not his sister, nobody, except a mes mitzvah, someone that does not have anybody else to bury him. The Kohen Gadol has to, not he's allowed to, not he's allowed to. Mes mitzvah means the mitzvah of burying someone, not that he's allowed to, he must. He has a responsibility of burying. Then later on, he'll have to go through a process of coming back into himself. Okay, this is how strict burial is. That it would suspend. I mean, it's amazing. I mean, think about it for a second. So let the guy. Where's he going anywhere? The cadaver's not going anywhere, right? He's sitting over there. It could be a green burial. Let him lay. No. You have to go yourself and bury it. That's how strict burial is. Why? Now, I'm going to ask you a question. Why do we take it to this kind of an extreme? Now you'll understand. After we talked about what the body represents, it's an aura of divinity. It's a God forbid seeing the king laying there. If you saw the king laying there, you're not going to go bury the king. And imagine the wildest imagination, you would walk by and see one of the kings of a Judean king there. You would go and you'd bury him. It would be a tragedy. It would be a shame to leave the king, buried over there. Same thing is true, that this body represents a divinity. Let us make him in our image. The image of Hashem is laying on the floor. You have to do whatever you could. That's the sanctity of the body is so strict. That's what we have to. That's how we have to care. And that's why we put a tremendous amount of effort into, having every city needs a Chevra Kadisha, needs a burial society, and the burial society takes their job seriously, and they make sure that, the body is taken care of, the shrouds are done. I mean, this is one of the biggest mitzvahs in the community, is to have a Chevra Kadisha, is to have a burial society with a cemetery that's ready and done, and gone. It's a huge mitzvah. My son Yankee, who lives in Kansas City, he's in the Chevra Kaddish. He tells me that he's done some taharas, cleaning the body. You're a kid from Long Beach, or you're in the Chevra Kaddish. He said, look, someone has to do it. The Makam Shein Ish is herring a fish, they say. In a place where there's no man, his herring is also a fish. I mean, it's a play on words, like, I guess herring is, but you know what? In a place where there's no man, strive to be a man. So that's an extremely important thing. And the Chevra Kadisha, they say it's a segula, it's a good thing for living a long life. If you belong to the Chevra Kadisha, you will live a long life. It's a tremendous mitzvah. So I think we've kind of covered the cadaver. Let's talk a little bit about organs. Because when organ donation, which is really a class for itself, but since this is the last class, we'll just talk about organs. So this is interesting. I'm just going to read this. It's called text number 18, if you don't mind. This is from Rabbi Unterman, chief rabbi of Israel, who himself was just a brilliant man. Number 18, I think it's on page. You find it on page 152. 152. So you cannot have any benefit from the dead body, obviously. The flesh from the dead is forbidden only as long as it remains lifeless. When it comes back to life, the prohibition is automatically lifted. What does that mean? Think about this for a second. It is unthinkable to argue that it would have been forbidden to derive benefit from the biblical figures who were resurrected. So too, remember the whole story of Ezekiel and the body, the valley of the bones. He saw that whole valley become resurrected. Now you can have benefit from them even though they were resurrected. So too, when a dead body part returns to life by being transplanted into a living body, there is no prohibition against benefiting from it. Because you would say, look, how could you take the eyes away from the cadaver? You take a dead man's eyes? No. If those eyes become alive again in someone else's body, it is the greatest miracle. This is because the ban against benefiting from dead applies not to flesh that once experienced death, but rather to that which is currently dead. This logic appears quite reasonable in light of the laws of the ritual impurity imparted by a corpse. It is obvious that a person who receives a transplant from a cadaver does not render others in the present ritually impure. You would think if you had a heart from a dead guy, so you're carrying around a part of a dead guy, so everybody that comes into contact with me should be ritually impure because I'm half dead. No. A kohen would be permitted to enter the same room as the transplant recipient. It is so regarding the laws of ritual impurity, it seems likely the same would apply to the Baruchim of deriving benefit from the dead. So, I thought that was very interesting because a question came up before transplants. How could you do that? You're nibble hames, you're desecrating the body. But once you take the organs and put them into a living body and the body is alive, the organ is alive, it is alive. And see these stories, these heart-rendering stories of just I came across of this bride that was walking down the aisle by a man that was carrying her father's heart. Her father had passed, but the man who got the heart came to her wedding and he walked her down. So it was like part of the father was there. So these are miracles. The transplantations are miracles. Think about it. If you talked about 100 years ago, they would look at you like, what are you, nuts or something? You'd be able to take an organ from one person to another person. But today we've done it. We've seen it. It's done. It's Pashut. Hashem has given us the knowledge to perform miracles. Now, what about donating? So we've talked about this a little bit in the past. There is an organization that really specializes called HODS, Halachic Organ Donation Society. I advise anybody who's any interested in doing this. They are the experts in the field. They've gone through every halachic question. You are allowed to donate if someone is going to benefit from it. Yeah. Okay, just like we talked about the autopsy. If there's someone that's going to benefit from it, you are allowed to donate your organs. The problem then becomes, as Dr. Lovich had brought up in a previous class, heart. Because the definition of death is different American than in Judaism. If you stop breathing, you're dead. In America, you stop breathing, boom, get the heart, send it over, let's do it. In Judaism, you're still alive. So that's where the problem starts to become. And I guess once the heart stops beating, is it still good? No, it's done. You need a beating, you need a living, a beating heart. So you have to make precautions about that. But if God forbid you could save someone's eyesight, and you're there and you want to give your eyes or kidneys or whatever, and they're healthy, because if you're not healthy, if you die of just cancer, they're probably not going to take any of your organs, I'm assuming, I would suspect. But if you can help someone with your whatever you can, then yes, You can do that. And, you know, in America, there's a tremendous shortage of organs. I mean, I think it's like, I don't know, there's thousands and thousands of people waiting on these lists to get, you know, whether it's a kidney, which is literally a lifesaver, because if you go through dialysis, you can do, but it's no fun. It's no fun. You're literally giving, a kidney or, you know, or whatever else you can donate, you know, to people. So it is something that is necessary. I'm hoping that in the future, you know, just like any of things, they're coming up with unbelievable things that, you know, you don't need a human kidney. We'll be able to, you know, develop a kind of a human kidney, you know, an artificial, and we won't need it. We'll be able to mass produce it. Why? Why will we get there? I'll tell you why. Because this country is run on one principle, and you know what that is?
Money.
It's like in the Talmud says, "Kesef minolon." How do we know about money? I mean, this is the joke always in Talmudic classes. Kesef minolon. How do we know that there's money involved? That's where the business is going to go. If someone could figure out a way how to make a ton of money off artificial kidneys, we'll put. Think about now. We have now drugs that you could lose weight, right? Ozempic, right? You know how much money is going into these drugs now? Forget about, this is where all the money of research is going. Why? Because it's a $10 billion business, you know, right now. So eventually, God willing, you know, we'll be smart enough when we put our efforts, when human beings put their efforts in doing something positive, nothing can stop us.
It'll happen in Israel.
That's exactly. And then, you know, and then the boycotters will have to,
Yeah.
I'm not going to say anything. I'm not going to finish the statement. But of course, it's a tremendous mitzvah of donating. I know some of my colleagues have done it, and others who've donated a kidney to a member of whatever it is. You know, if you're able to do that, it's a tremendous mitzvah. The recipients, are forever grateful. Leukemia, you know, if you can, you know, do that with your bone marrow, you know, to do that is a tremendous mitzvah. But again, if you want more information about this, I strongly suggest just go to HODS, HODS. That's all you have to put into the Google search, you know, HODS, and it'll come up, and they'll tell you exactly what, when, where, and if you're really serious, I would contact one of those rabbis and go through what you could and what you can't do. Because once you sign that you want to give, then you're out of, you know, that's out. You know, once they get you and you're done. You know, you're done. So you got to be careful. The key, of course, of all of this is not to talk about dead people. Okay? Because that's one thing. It's a mitzvah to bury the dead and to treat them with respect, and to do everything we have to do in a timely fashion, and bury them in the ground, and do all of that thing. But the key to all of this is to live. That's the key. Okay? The key is to live. Because as long as we're alive here, we have a mission and a duty and a destiny that has not been finished yet. And when I've in the past 2 days burying two people, I just kept thinking to myself, like, you know, like King David always likes to use imagery, you know, in Tehillim. You know, he likes to, and one of those is grass. He loves talking about grass. A number of times he talks about how in the morning grass, you know, is flourishing, and then by afternoon it's kind of with, and then at night it's gone. Wilson, it's gone. Why does he? Who's he writing that to? To us. Yes. To us. He's writing it to us. He's not writing about the grass. No, he's writing it about the human being. How not to take time, you know, to take time seriously. That, you know what, you know, we talk about God, unfortunately, people that have passed away. For us that are living, we need to do everything we can to live. And when we talk about living, it's not, see, people think living is breathing. Oh, you know, I wake up in the morning, I take a breath, or I eat breakfast. That's not living. That's not walking through life. That's like, you know, like, I tell the story a million times. In our Wednesday class, I'm doing, now remind me tomorrow, please, if you're there, that next week is no class because it's Shavuos. I have to remind everyone tomorrow. So if I remember, there used to come an elderly black gentleman, Charles Johnson, came to the class once. And Charles Johnson, he came into my class and he sat in the back of the room, and he had the face of someone that lived. You know, like, he just looked like he lived. He had this stunning black and white hair, and he had this face that, you know, and I'm talking about the same concept of how we have to live. And he pipes up and he says, lived to 65, died at 35. Think about that. On his tombstone it said, lived to 65, died at 35. Meaning that at 35, he gave up everything of life. He just walked the last 30 years, he walked doing nothing. And so he summed up my whole class. That's the genius of a human being, is he sums up a rabbi who could take, whose specialty is to, what do you call it? Make a long story short, is to make a short story long. That's the rabbi's specialty. Okay, so in our class, he sums it up in one sentence. On his tombstone, Rabbi, it read, lived to 65, died at 35. Wow. I went over after the class. I remember it. He disappears. Then there's an addendum. He shows up again. A couple of years ago, this was before COVID. He comes into the class. I say, Charles, so good to see you. Where have you been? Oh, Rabbi, I've been around, Sits down in the class. Okay. At the end of the class, he hands me a small little thin envelope. He says, Rabbi, this is for your class. I really enjoyed it. Thank you. Yeah, I take it and I just put it in my jacket. And I think, he didn't look like he was coming and driving in a Rolls Royce or anything like that. He leaves. I go into my car. I'm putting off my jacket and then the envelope falls out. Okay. I pick it up. And then I get a $20 bill. 10 $100 bills. There was $1,000 in that envelope.
Wow.
I go, then I get out of my, now I'm embarrassed because I just gave him like the perfunctory, oh, thanks, Charles. I run through the parking lot. I'm looking at each car. He's gone and he disappeared.
You ever seen him again?
Never saw him again. Don't know. To me, it was like Elijah came into the class, said this one sentence. You know what? Lived to 65, died at 35, stuck in my head, and I've used it a million times. And number two, Elijah came back, knowing that I needed some money in the shul, dropped the grant and left.
Hey, maybe we show up tomorrow.
You never know. You never know. I've always thought about this man. Not always thought about this man, but from time to time I think about how angels come into our lives. We don't believe in angels because we're sophisticated, people in America, we're educated in angels. I believe in angels. And I believe that angels come into our lives, not in the sense of flying with their wings, but people who come into your lives, even for a moment or 5 moments, that do something for you that could change your life around. One of the darkest moments, and I'll just finish with it, one of the darkest moments of my life was when one of our members' child was diagnosed with leukemia. And they were here in the hospital in Millers. Millers does not have a pediatric oncology ward. It's in the hospital. You have to walk through a tunnel. And walking through the tunnel with that family was the worst. I mean, you know what it means? Your child is now diagnosed with cancer, 5 years old, when you have to go to pediatric oncology, ward. You come up to the ward, they settle them into the room, the bed and everything. The mother is there. They're ashen-faced. I mean, it's just a terrible. It's like getting a sentence from the court. All of a sudden, from down the hall comes this black woman to the mother and tells the mother like this: I want to tell you, my grandson is in room 6A. In this ward, there is no color here. There's no color. There's no gender. There's nothing. We are all in this together. And whatever you need from any of us here in this ward, we are here for you 24/7. And she hugged her and held her tight like a mother would hold a daughter. And I said, this is an angel from heaven. Right. I could not do this. The husband could not do this. The nurses could not do this. But a grandmother that's experiencing what she's going through with her grandson 2 doors down, hugs her and says this to her. You cannot convince me that this was not an angel that came down to heaven in the form of this grandmother. And there are millions of people that do this every day to us. All we have to do is be cognizant. We have to be open to understanding that there are people like this in the world. Anyways, that's right. What's going on, and I want to let the people in the Facebook world go. Thank you for joining us for these past 4 weeks. If you enjoyed this class, I urge you to continue studying about Jewish medical ethics. There's so much more to discuss than we were able to do in the few hours that we were together. But again, thank you. In a couple of weeks, we will reveal next year's 3 courses. They seem to be very, very, very exciting, and I hope you'll join us again then. Until that time, have a wonderful, wonderful evening.
Very good.